3 minutes to go and ask any of the questions to the founder. So with that, Tremaine, I'll let you go.
All right. I need to share screen, right?
Yes.
Share screen. Let me see. Sorry, I have to jump and come back in because I needed to accept the share screen
Oh,
thing.
okay.
I'll be right back.
Okay, great. Maybe someone has one more health hack. Oh, or Sam, are you going to go next?
I was going to say, if he has any issues, I can step up. I'll give him a second, but
He's right here. So,
Yeah, we'll go stand by here and then.
but I love that you're at the ready. He should be coming
always.
in. Boom, done.
All right. I can share. Okay. Can everyone see my screen?
Yes.
All righty. All right. So in 2019, one of my best friends sealed the deal with the girl of his dreams. The bachelor party was in Mexico, and all of myself and the groomsmen, we were all super excited to join. Um, until we realized that the dad's bods were definitely dadding. So I had this idea. I created a WhatsApp group where we had daily workout photos that we would post into the group. So these photos are all from our WhatsApp group. Anytime you missed a day, you would have to put $5 into this prize pot. The most consistent would take all the cash at the end. So just a little bit about me. I've been a personal trainer for the last 10 years. I've worked all across the life sciences industry for Pfizer, Eli Lilly. I'm a software engineer. I've been building clinical trial software for these companies. So I could definitely not lose this challenge. It would be very embarrassing if I did. So I actually went really hard in it. But one of the fascinating things that I realized during this process was that guys that had never worked out before were suddenly working out every single day. And at that point, I realized that when you make fitness social and competitive, it's almost impossible to quit. So again, my name is Tremaine Grant. I am the founder of Pulse, a gamified fitness app where pros grow, users level up, and everyone wins together. Now, usually at this point, I do an experiment where I have everyone raise their hand if they've heard of a social media app. Typically, the room, it's about 100%, everyone raises their hand. But then I ask, keep your hands up if you can name a fitness app. And typically, about 80% of those hands go down. So, because the truth is, if you asked 100 people to name a social network, you'd probably get one of the big five, which is Instagram, Twitter, Snapchat, one of those. But when you ask 100 people to name a fitness app, you're typically going to get 100 different answers. So what that tells me is that the fitness market isn't oversaturated; it's actually fragmented. It's wide open, and there's no dominant player that is really owning the top of mind spot in the fitness app market or fitness technology. Our vision is that Pulse is going to take that spot. So I want to do something a little different in this pitch. Normally, I would just go through my company, but I wanted to really focus on looking at what the future of fitness looks like for the next 5 to 10 years. Because as you guys all know, um, the market is changing every day with AI. If any of you guys are familiar with any of these AI models on the right side, AlphaFold, FunSearch, AlphaEvolve, these are all models that are creating novel discoveries in mathematics and science, and even able to simulate the 3D structure of every known protein to man, which is over 200 million proteins. So what AI is going to do is it's going to really change health from necessity to optimization, from survival to performance, and from treatment to enhancement. What does it look like when health is no longer about survival, but it's more about elective and performance? And the company that builds an operating system with this new era of health, that's the company that wins the next decade. And we're doing a lot of that. So I'm going to start by giving you guys an overview of what we're doing now and what we're building. At the core is Pulse. We've built this app on a very simple hierarchy, moves, stacks, and rounds. And a move So a move is a 5 to 30 second clip of any physical movement, a lift, a stretch, an exercise, anything that gets the body moving. And content creators can create other full libraries of these moves, these short clips. The next part of the hierarchy is a stack. So a stack is a collection of moves. So think of a workout list you might bring into the gym with you, that you might complete in that day. It's shareable, it's trackable, it's social. And then the last piece, which is a round. This is where the magic happens. So a round is, think of it as a collection of stacks. It turns those stacks and those moves into a multiplayer game where communities can compete together through multiple challenges that are executed over time. So you can see there's this leaderboard here. It tracks how much workouts everyone is completing. It even shows you who they're inviting. So one of our North Star metrics is shareability. How easy is it to share these rounds with other people? So we've kind of really built in something that we call the ACCI framework. So think about that bachelor party story I told you. Those guys didn't suddenly just gain fitness knowledge. They gained accountability, connection, competition, and intrinsic incentive, whether it was the prize money that they were motivated by or simply the bragging rights. We use these interactions and these different behaviors that we've built really intentionally to really figure out what are the motivating factors for each person. So now going back to the future. So Pulse is this data engine. So we look at it as gamification was the best way to do this, because when you think about gamification, what does gamification get you? It gets you a lot of data. I'm going to show you guys. So we actually collect a ton of data on the Apple Watch. So if you didn't know, the Apple Watch actually collects more data on this watch than the Apollo program was able to capture. So with that data, we're able to tell a story. So it's not just about how much calories you eat. We talked about, the eating hacks. It's really not just about what you're eating, but how much are you burning? So what are your calories in versus your calories out? What story does that tell? So we actually have a feature called Health Data Stories that outlines what type of sleep you're getting, your recovery. There are metrics such as ARV on the Apple Watch that people don't even really, Apple doesn't surface a lot of this data, but ARV is actually way more telling in how stressed your body is during your workouts. It's just heart rate variability. And then you have sleep patterns. So all this data, we are able to gamify that data, but the true value of it is the context. So AI is going to be able to take a lot of our context when you look at prompting, being able to take context and build other products on top of it, such as Pulse Check, which is going to be our sports psychologist that is able to know everything about that person and their physical activity. And then Pulse programming, so being able to build a program, a process that might usually take a couple of days can now be 5 minutes because we have full context of the client. So just some quick traction. We built our MVP and we've been testing since May 2024. We did a public launch in January 2025. We have 900 plus users, 164 that are paid on our subscription, 50 content creators and trainers, which we're continuing to build on, 500 unique moves captured, and over 5,000 completed workouts. We have a great team where I'm continuing to build. My chief of staff, a newly Harvard grad. He was a former TED speech coach, so he's very good at storytelling, and really excited to get him ramped up. We have a UI UX designer, and we have our digital creator lead. So he is the one that is really focusing on the human aspect of this. So I'm very dialed into the AI, but he's out talking to the folks at the events. So have a great advisory board as well. This is our subscription model, how that all looks. So we have a monthly subscription for fitness seekers, and then we also have an annual subscription for content creators that are looking to monetize their content on the platform.
Awesome. Well, Tremaine, hey, thanks for taking the time to go through this. I got a question I'll put in the chat. And if others have some questions, feel free to put in the chat and Tremaine can respond there. But love what you're doing, and we'll kick it over to Sam. Thanks, Tremaine.
No problem. Thank you.
Awesome. Good job, Tremaine. And luckily he went over a bunch of information that I'm going to cover with wearable data.
Great.
Looks like I have to send you a request to, there we go. Awesome. Perfect. Thanks to Atlanta Ventures for the opportunity to speak. Hopefully everyone should be able to see my screen now. Tremaine, do you see it? I know that you're still.
Yep, I can see it.
Excellent. Thanks for being my resource. Happy to join everyone as they're drinking their coffee and talk menopause. I know you woke up this morning thinking, what should we think about? And hopefully over the next 10 minutes, you're going to be obsessed with menopause like I am. Again, my name is Sam Smith. I'm the co-founder and CEO of Amissa. We're revolutionizing menopause care with clinicians through wearable and symptom insights. Some quick menopause stats. Currently in the United States, 75 million women are experiencing perimenopause, menopause, or postmenopause. All of them experiencing symptoms, 77% experiencing one or more symptom that they would call very difficult. And this shows in their daily lives. 1 in 5 women consider leaving their workplace because of menopausal symptoms. 70% of perimenopausal women who get divorced blame their menopause for that divorce. So it can cause a lot of suffering amongst this group. And it takes on average 10 and a half years to go through the entire process, with symptoms changing in severity, as well as just different symptoms in general. It can be challenging to understand exactly how menopause is affecting you. There are 40 plus menopausal symptoms. Many folks familiar with hot flashes, night sweats, maybe brain fog, but women have a hard time deciphering, okay, if I have painful sex or low libido, what's happening to me? Perimenopause is almost like puzzle pieces being thrown at you without the picture. And typically women would hope to rely on their physicians, but there's a pain and stress in the United States there, with 86% of physicians claiming they don't have enough time during their visits. Their visits pretty much the same amount of time as the length of this pitch, to give you context. So not enough time to not only teach about menopause, but also get into those deep conversations, leading to multiple appointments. And in general, during those appointments, only 7% of the OBs that are meeting with these patients actually feel sufficiently educated in menopause, creating a perfect storm, or as we like to see it, a perfect opportunity. So this is where Amissa steps in. We collect wearable data and symptom inputs to curate insights for providers to improve midlife care. What this means is that we can increase patient and provider education about what menopause is through our iOS app, as well as make the experience more efficient when it comes to patient prep through insights of what these symptoms are for each individual patient, as well as appointments more effective by understanding exactly what this patient is going through before they enter the room, creating better treatment plans by monitoring when they leave how effective either that hormone therapy or other plan is, and measuring its effectiveness, causing less visits and better care overall. We created every piece of this application with the advice of our medical advisory board, as well as conducting 75 interviews with doctors, patients, and researchers to ensure that we're creating a solution that can help clinicians provide better care. All of our medical advisory board are on the Menopause Society. Rebecca Thurston was actually the president of the Menopause Society, and she was actually mentioned in the New York Times just last week. So she's an expert leader and known amongst most OBGYNs across the nation. So how it works, hopefully you'll walk away feeling that this is a really simple concept, because that's exactly what we think it is, serving a large, painful market. Patients are invited by their providers to Amissa. This is where they'll learn about all of their relevant insights, symptoms as they go through the onboarding process. They are going to be invited to share their wearable data. We can take in anything that can go into HealthKit, so that's your Oura Ring, your Apple Watch, your Fitbit, where we can track sleep, which is a huge factor when it comes to menopause, whether it's insomnia or waking up due to night sweats, HRV, and exercise. We encourage the users to input other symptoms and activities like their period, as well as hot flashes, joint pain, vaginal dryness, anything that can't quite be measured through a wearable. And then we feed them with insights that either inspire validation, action, or give them confidence to self-advocate with their providers. Now, the clinician, they can either decide to include Amissa in their membership offering, providing it to all of their patients, or allowing each patient to opt in. They can set goals for their patients to track specific activities to make sure they get the clearest picture of how that patient is doing, especially when you consider how they can compare in their insights page, how their period is tracking with specific symptoms, as well as how their care plan or how their hormone therapy is doing relative to the symptoms that they're experiencing. We can easily create views to showcase when someone is going through something abnormal, flagging bad trends, and then make sure that data is incorporated either in their EHR if they prefer, or just directly on our platform. So how we're different. One thing I really want to emphasize over the next 2 slides is that menopause is a very large open space. We're not trying to get a sliver of a pie. It's a land grab at the moment. And we're hoping to take advantage of it with our approach, focusing B2B, specifically going to the trusted provider to enable a patient to share their data, focusing on wearables, where again are integrated into HealthKit, and soon we'll be able to integrate into Google Fit. And then providing and leaning on AI insights for those data to really showcase exactly what that individual is going to inspire an easy to use remote monitoring option for patients to showcase how effective their hormone therapy is and adapt their dosage if needed when the doctor sees how well it's going. One thing I want to highlight in our competitive analysis too, all of our competitors are actually ideal partners, as well as just are showcasing great opportunity in the space, including last week or the week before, Aura announced a relationship with Maven. Maven made popular because of their fertility support, showing how wearables and healthcare providers are really starting to take footing in the market. It's a huge market, 131 billion according to Amboy Ventures, just for the menopause space alone. Hot flashes alone is a $19 billion market. We're focusing specifically on our go-to-market with OBGYNs. There are 40,000 across the United States. Now, again, menopause is not bikini medicine. It affects your whole body. If you consider that heart palpitations, you would go to a cardiologist. If you're experiencing brain fog, you might go to a neurologist. So in the long-term play, we do want to help and serve anyone trying to assist an individual in their midlife. But for our go-to-market, focusing on that integration with Athena, looking at roughly 8,000 OBGYNs who service on average about 500,000 patients overall. And that's our go-to-market strategy. We're launching in October with an Athena integration. Currently, we have 2 signed pilot customers, a third one right around the corner. The total contract value of those 2 pilot customers is $530,000. 2 of those pilot customers are on Athena. The other is servicing this as an outside, unattached to their EHR. So dependent upon your model and what works for you and your patients, we'll be able to serve it. We are NIH backed and have 12 months of runway, but we are currently introducing ourselves to different partners and investors who may be interested in looking at seeing our traction rise. Quickly, because I see AT jump on the screen, so I know my time is about to wrap up, but our model is simple and built to scale. We're focusing actually on charging the patient themselves with incentives to waive EHR costs to make sure that barrier is as low as possible, paying through the doctor, which will enable us in the future to upsell, and providing a cost that has really nice margins, but also takes into consideration that EHR cost. If you'd like to meet with me, I can go through our growth projections, but more importantly, I want to showcase our vision, which is right now we're in the process of gathering data, finding ways to make sure it can be leveraged to support in those conversations. But our overarching goal is how can we help potentially make all of our doctors smarter by playing that AI advisor in the room for all specialties, and eventually growing our growth plan by finding a way to cover it by insurance. Lastly, we're the team to do it. I have 10 plus years in startups, 3 different startups as a founder, focused on sales. My co-founder is a 2-time NIH principal researcher and peer reviewer. Our focus is not to drop the ball on figuring out ways we can have non-dilutive capital. And then our CPO, COO has exited a femtech startup focused on OBGYNs and has raised $8.8 million. And I'll leave you with this, just a high-level overview of why this opportunity is so great and why we would love to learn any questions from you or meet all of you. Is the time is right. You can see the demand for menopause solutions is rising. We're the right team for it, focusing on wearable data and focusing on research, our NIH backing, our research approach. And lastly, menopause is really messy. There's a lack of research around it. The data isn't organized. Women are trying to experiment, and you can see it on TikTok with what works. Amissa is making it smarter, safer, and faster, and we would love for you to join us. Pretty pleased as far as my ask. If you guys have any intros into menopause specialists or OBs, we would love them. We're in search of a head of AI with healthcare experience. And lastly, if you are interested in the opportunity of potentially joining us as an investor or partner, please reach out to me. We are raising in the fall. I'll drop my LinkedIn in the chat. Thanks, AT. Sorry I went over.
Awesome. You're good. Thank you, Sam. And I have a question I'll put in the chat, and others, if you have other questions, feel free to put them in the chat for Sam and team. But thanks for sharing.
Thank you.
All right, Kareem,
Oh,
transition over to you here.
all right, all right. Let's see. Okay, and if I move this out the way. Is my screen showing?
Yes.
Okay, perfect, perfect. Hi, everyone. My name is Kareem. I'm a co-founder of Senior Shield Technologies, and I would like to begin with a story. I met a nurse named Jasmine who told me about the time she took her mother to the hospital for surgery. Jasmine said Suella did not return. After surgery, her mother's incontinence brief was unnoticed, causing a preventable case of sepsis. The truth is that incontinence threatens more than 27 million American seniors. This is a condition where a patient loses control of their bladder or bowels, and briefs are worn to capture the waste. Soiled briefs have to be changed quickly, otherwise bacteria from urine or stool can cause urinary tract infections. The second leading elderly infection, costs $3 billion a year to treat, and can be deadly. But despite this threat, there is an urgent care crisis, driven by a soaring elderly population and a severe shortage of nurses. Accidents happen anytime, and worst of all, caregivers currently guess and check whether a person needs to be changed. Physically probing is uncomfortable, unsanitary, and undignified for everyone involved. Our solution is an incontinence monitoring pad that lets caregivers know when it is time to change. Our pad goes on the outside of any brief with adhesive. When a urine or stool accident occurs, we send a digital alert to a caregiver's device to prompt the change routine. To date, we've had more than 200 conversations in elder care about incontinence, and what we've learned is that nurses and families are in distress. This disease causes isolation, depression, embarrassment, and fear of asking for help. When we go to facilities, we find that they're suffering. Medicare claims that the average ratio of nurses to patients is one nurse serving 12 patients. But in our customer discovery, we've seen one nurse serving 16 patients, or even one nurse serving 21 patients. This is one nurse responsible for bathing, medication, feeding, and the incontinence routine, which is not sustainable. And when we talk to families, it's even worse. They are facing a $600 billion crisis to take care of their loved ones at home. When we talk to caregivers, we hear about the chaos and anxiety they feel about not knowing how to manage the change routine and laundry. We hear the shame that patients feel due to their condition. They were once independent and have now lost some agency. And we hear the burden that caregivers bear, taking care of their loved ones and working a 9 to 5. Other diseases can also arise from prolonged exposure to soil, including pressure sores and dermatitis. We've also learned buying criteria for our product. Right now, competitors put disposable moisture sensors inside of a garment to check for urine. From our customer discovery, nurses and families prefer us because we are reusable, pursuing Medicare insurance coverage, and are safer. We keep sensors away from sensitive skin and check for both urine and stool. We've had validation of incontinence as a major threat, with willingness to pay up to $500 for our solution. We've been given packs of briefs and incontinence supplies by hospice agencies to help us build the product, and we've identified private paying families as our entry point. We've also been a vendor at 2 senior care expos in Atlanta, including at Centerwell, which is owned by Humana. At Centerwell, a lady walked up to us and said, "I wish I had this when my mother was still with us." Her mother was incontinent and had passed of Alzheimer's, and this speaks to the grief that this condition can cause families. And so here's our plan to address this pain. Back in April, we filed our provisional patent for our device. We have a handmade circuit that can tell the presence, location, and amount of soil in a garment. The graph that you see here shows a linear relationship between our sensor readings and fluid volume, which helps us to tell caregivers when to change, not too soon and not too late. Our product is a class 2 medical device, and we need clinical data to show the benefit for patients. And with this combination, we're seeking Medicare coverage as a remote patient monitoring device. In our customer discovery, we are working towards our first pilot of our tech with an adult daycare in Atlanta. We value Medicare coverage so much because 94% of older people receive healthcare through Medicare. Our claim is that with quicker changes, there's less exposure to soil, which boosts patient and caregiver morale and restores dignity to patients. With less exposure, there's also a lower risk of infection and therefore lower cost of treatment. This matters because delayed incontinence care contributes to a $65 billion crisis. We hope to serve all sectors of elder care, both families taking care of their loved ones at home and facilities. We sell the product for a one-time fee, and we charge a subscription for facilities to generate reports on how their nurses are performing. We are Georgia Tech engineers and computer scientists. We have experience in research, medtech, and personal connection to the problem, including in my own family. We've received 10 awards for our work to date, including from the Mayo Clinic. In the summer, we are involved in 5 accelerators, including with the National Institute on Aging, to help us push our venture forward and start serving patients. So I hope you will join us in our mission to restore dignity in aging and to address the issue of incontinence. I'm happy to answer any questions in the chat or offline. Our email is seniorshieldtechnologies@gmail.com. Thank you for the opportunity to speak today.
Great, Kareem. Thanks for going through. I think we got time now for a couple questions here. Put them in the chat for Kareem, but I'll ask one here. You mentioned, I think, in the deck of targeting private pay to start.
Yes.
Tell me more about how you're thinking about private pay versus insurance versus facilities of who would pay.
Right. So the recent CMS cuts are they're devastating nursing homes, candidly. So our focus in private pay is helping families keep their loved ones at home for longer. So we look at home care agencies, we look at adult daycare, and the value proposition there is aging in place. If a person can age in the home they've lived in for generations, it's healthier for them than having to uproot and move to a nursing home where they're more dependent on an insurance like Medicare, Medicaid, or their private insurance. So with this, I think we find people are more willing to move because they value more time with their loved one. Hopefully that answers the question.
Got it. Got it. And then Kareem, similar to, Sam made an ask, of the audience here, looking for some help with, with hiring or fundraising or potential customers. How can the audience here help you?
Absolutely. So if any of you have been a caregiver, know somebody who's been a caregiver, have any connections to senior care, would love to have a conversation. You can reach out, you can put your contact info in the chat and send me a message, and I can reach out and we can schedule that offline.
Got it. Great. Well, thanks, Kareem.
Thank you.
With that, I'll ask Sam and Tremaine to come back on the screen here. And Tremaine, I'll jump to you as well. Same question I just asked Kareem. How can the audience help you? What are some things you're looking for where the audience may be able to help you?
Yeah, some of the things that we're really trying to work towards is accelerators. So that's really big for us. To your question about, connecting to larger groups that might be able to, engage with corporate partnerships is something that we've been looking at. So if anyone has an experience there, that would be a great resource for us as well. And I'm also looking to build my team as well. So marketing is a big part that we're kind of lacking right now. Marketing expert. So anyone that knows
Is it like more consumer marketing, like direct to consumers to get them interested?
Yep.
Got it. Got it. Well, great. Well, hey, I'll ask one other question, to all of you. Y'all been founders. We know how hard this journey is of, getting it started and all the ups and downs. What's a key lesson learned you've had so far that you'd share with other entrepreneurs that may be on this call, that may be doubting themselves or struggling? Anything you've learned that could be good advice for them.
For me, I think something that I've really learned is that this is my second startup. And I think the first one, I focused so much on building a venture backable business rather than just focus on building a sustainable business. So sustainability, I think, is a big thing that a lot of founders miss. They're focused on a lot of the other things rather than just like, is my business model solid? So really making sure that is like really efficient.
100%. I think to that point, I think we see lots of startups, and you don't have to raise venture funding to be a successful startup. In fact, most probably shouldn't raise venture funding. So I like your learning there of, hey, build a great business, and whether it needs funding or not, you can debate that, but build a great business and you'll have a lot of options in front of you.
Correct.
Love that. Thanks, Tremaine. Sam, any lessons learned you'd share with the group?
Yeah, I feel like I love the business model thought because that definitely took me one or two startups to figure out. So good note. I think the core thing I've learned over time is I'm lucky enough to have my co-founder and member of my team on this call supporting me is find good people to support you and don't forget to just lean into founder relationships. They're great not only for networking, but it's a very isolating and lonely journey. And I promise you, whatever like the worst thing you're dealing with right now, there is someone in probably right around the corner who has dealt with the same exact thing. And honestly, it makes you feel more sane knowing that you're not dropping the ball in any respect just by speaking with other founders. So lean into taking time to meeting other founders, even if it doesn't seem like the benefit is very obvious.
No, that makes a lot of sense. And we see that all the time. You hear at Atlanta Tech Village, just all those serendipitous interactions that, you're into somebody grabbing coffee, you're in the break room. And then like, to your point, even though we all have different businesses and ideas, there's a lot of commonalities to entrepreneurship. And odds are somebody here has just experienced that recently or 3 months ago. It can share some lessons learned, or vice versa. You can help somebody else out based on what you've done and learned. So love that, Sam, about the people. Kareem, any sort of nuggets of wisdom or lessons learned you'd share with the group here?
Yeah, what Tremaine and Sam said is awesome advice. And to add on to it, I would say strong sense of why, because I mean we get asked this all the time, like why are you doing this? Like there's other things you could be doing and that are easier. Candidly, healthcare is not an easy industry. Like Sam, you mentioned 75 interviews with between patients, providers. That's hard to get. So kudos to you. But I think a strong sense of why, at the end of the day, our goals ultimately are to serve people and make their lives better, and not losing sight of that. I think Tremaine mentioned not building a venture-backed business, but building a sustainable business. That's part of it, I feel, is there's a purpose, a mission that's bigger than ourselves.
Awesome. Well, thank you all three for sharing your stories, and best of luck. Look forward to following your progress, as you move forward. As we wrap up here today, hopefully everybody met somebody new in the networking or made a connection here. But that's part of what this is about. We've got on our webpage, atlantaventures.com/healthcare. We've got lists of other startups in Atlanta, so you can find other ones that may be doing something similar to you or you can connect with. We post all of these meetups and past recaps. Check out any ones that are interesting there as well. And there's some upcoming events. Every month, we do an office hours with Atlanta Ventures. So myself and Catherine and JC that we're on here there. Feel free to jump on, ask any questions. Always good to hear questions other entrepreneurs are asking and learn from them. So feel free. The next one's in August. We just had the July one. And then our next healthcare meetup is going to be August 20th. So it's going to be similar format. We have a couple other early stage entrepreneurs presenting what they're working on, and then we're working for October, November, doing an in-person one at Atlanta Tech Village. So more to come on that. So with that, thanks again, everybody, for joining. Got a couple of minutes here before 10 o'clock, and everybody's off to a busy day. But thanks for joining. Hopefully you enjoyed it, and we'll see you next time.
Thanks, y'all. Have a great day.
All
See
right, take
y'all
care.
You
soon.
all.
Thank you. Bye.